ARU3, 81 female, possible CVA, confusion.
Medical problems are the Spokane Fire Department's #1 call for service. However, once medics arrive, sometimes they find the patient who dialed 911 really isn't in need of high-level emergency care.
Somebody having non-priority symptoms, sore throat, hurt shoulder, nondescript abdominal pain.
Up until early last year, those low acuity cases were transported to local emergency rooms because there were no other options available.
We have always put people in the back of an ambulance and taken them to the hospital.
In 2016, that old school way of dealing with 911 calls led to 10,000 ambulance rides to the ER, and later doctors determined a lot of them really weren't necessary.
Those increasing number of calls for those situations actually overwhelm the emergency care system and take resources away from the cardiac arrests, the strokes, the heart attacks, and that kind of thing.
And that's why Spokane and Spokane Valley Fire are now taking a new approach to their medical calls, a program called Spokane Ride to Care.
Hey partner, how you doing?
So dial 911 and you'll still have EMTs and paramedics evaluating your injury or illness in a matter of minutes. But how and where you're taken for treatment could now be different.
We'll provide at no cost a transportation from their residence or from the scene to the urgent care.
MedStar Transportation has a contract to provide ride-to-care service. Their paratransit vans are wheelchair accessible and equipped with fire extinguishers. Drivers like Damon Agnew know first aid, CPR, and are dispatched to calls at the fire department's request. Patients are taken to participating urgent care centers, but only if their symptoms don't warrant emergency treatment.
Chest pain that's cardiac related, even if it's minor, strokes, any kind of major trauma, those people are not going to be referred into the program.
How you feeling?
Great.
Great.
On the other hand, patients with non-emergent health problems can use the van to get to an urgent care facility where they're going to get treatment and start feeling better a lot sooner.
By getting somebody to an urgent care, they're going to get access to a physician or a nurse practitioner faster than if they went to the emergency department and sat in the waiting room.
Oh, absolutely. You get the appropriate level of care, but at the same time, you also get timely care.
The Ride to Care van also picks up patients after they've been treated and takes them to participating pharmacies to have their prescriptions filled. Spokane Neighborhood Action Partners, or SNAP, help find funding for Ride to Care and administers the program in the hopes of providing better medical treatment.
So we're not denying care. What we're doing is trying to get them the right care. So right care to the right person in the right setting at the right time.
Experts say by letting paramedics triage 911 medical calls after they arrive on scene and then using Ride to Care when it's appropriate can save everyone time and money.
Can we improve the healthcare experience for the individual, getting them better access to care faster, and then reducing the overall cost to the healthcare system?
However, to make sure Ride to Care is meeting performance standards, SNAP has asked the Spokane Regional Health District to independently assess the program.